Good afternoon, everyone. My name is Shauna Lawson. I'm the Director of Research and Social Innovation here at VIA Sport. It's my absolute honor and privilege to be moderating this webinar this morning. We have nearly 1,000 people joining us from hundreds of communities across BC and also some in Alberta. But I wanted to begin by just acknowledging that we do most of our work and we're hosting this webinar on the traditional, ancestral, and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh First Nations. The purpose of our call and our agenda today is really laser focused on one thing, and that is to provide clarity. So if we know anything about 2020, it's that we've all been plagued by this sort of consistent level of uncertainty. And so while we don't have all the answers, our goal today is to provide as much clarity as we can and be 100% transparent and with our up to the minute information on what we know about return to sport and the current restrictions and orders in BC. In terms of an agenda, we're going to start with a welcome by our CEO, Charlene Krepikavich, and she's going to speak to how VIA Sport is at the table, along with recreation, fitness, and education with the Ministry of Health. We'll then move on to a more formal presentation by our Director of Provincial Activation, Jared Cope. He'll speak to what's in the current order, where there's some complexities and confusion, and really what the process looks like for how VIA Sport is working with the Ministry of Health and with others. We built the agenda around answering your questions. And so we'll finish with nearly half of the webinar time with Jared and our Director of Sport Development, Heather Beattie, answering your questions. Just a couple of housekeeping things before we jump in. The first is that we are recording this webinar and we will be sharing it. So if you have some colleagues or friends who wanted to get on and couldn't, we will be sharing it by the end of today for your viewing pleasure. The second is really around questions. So it's my sole job today, well, one, to end us on time, but two, to answer as many questions as possible. We had nearly 150 pre-submitted, and we know that it will be nearly impossible to answer all the questions. That said, they are critically important. So the way you can ask a question is by clicking Q&A at the bottom of your screen and entering it there. We have two staff behind the scenes, myself and Heather, that will be looking to group these, theme them, so we can prioritize and answer as many as possible. If we don't answer your questions today, they still matter a great deal. We use those questions in our conversations with the ministry around where there's still confusion or where we might need added communications. So with that, I'm going to send it over to Charlene for a welcome from VIA Sport.
Great. Thank you, Shauna. Hi, everyone. This is Charlene Krepikavich. I'm the CEO of VIA Sport BC. It's my privilege and honor to be here and welcome you to this update. Thank you so much for joining the call and taking an hour out of your day to really listen to this update and to ask questions. We're here to provide information so that you are as informed as possible. So where do I want to start? First of all, I want to thank you for your incredible leadership, your passion, and your concern for sport as we have all tried to navigate these very challenging times. I understand the profound and important role sport plays in our communities. Sport is a community builder. We know that. Sport provides not only physical health benefits, but mental health benefits to our communities, which are very, very important, especially now during these challenging times. This hasn't been easy for anyone. And again, I appreciate the opportunity to bring you together on this call so we can share what we know and to also listen to your concerns. Before we pass it over to the VIA Sport team for more detailed updates, I do want to outline kind of 3 key points. First of all, what is our role? Who is VIA Sport? So VIA Sport is the nonprofit society with a mission to grow amateur sport and steward the provincial government's investment in the sector. Government views VIA Sport as their agency of record for amateur sport, and one of our key roles is to represent the voice of sport to government and government's voice to the sector. It is our priority to listen, to enhance these relationships and advance the case for sport. Each day we gather and track all the issues that you've raised, and we elevate new ones to government. Today, I really want sport to be a player and a contributor to the COVID solution. It is time for us to strengthen our relationship with government, to find solutions, and to prove our important role in improving individual physical and mental health and reconnecting our communities through sport. So, second key message, we are at the table. So, as I described just now, we play an important role in working with government. And most recently, we were asked to join a committee that the Provincial Health Office established that brings together sport, recreation, and fitness. This committee reports to the Provincial Health Office COVID Executive Committee, where Dr. Henry and others guide the provincial COVID response. So we are a standing member. Via Sport is a standing member of this committee, has a seat at the table. This is a relatively new committee that was just formed, and we've met a few times, and so we are advancing these issues through this committee. So we have a seat at the table, we are advancing the issues and are getting traction on these issues. As you can appreciate, these are very challenging times for government. You know, they're responding to community needs, to the transmission of this virus, and you know, sport, and like many other sectors, are facing incredible challenges. But we are doing everything we can to ensure the voice of sport is represented. And finally, I just want to say that, like you, we want solutions. We want to see sport. We want to see and advance the case for sport. We want to keep sport open. Through this entire process, we've had to look at this from a health lens and understand the conditions that the Provincial Health Office is trying to solve for, and then present solutions for sport. While we listen to each of your concerns and understand the unique complexities of each of your sports, we're trying to solve these issues sort of from that ecosystem, the system level. And sometimes when you look at policy, while you solve some issues, others emerge. So it is challenging to find a policy that's going to work for everyone. But we're here to listen. We're sitting at the right tables, and we're trying to find solutions. So just wanted to echo these 3 key points and assure you that we're doing everything we can to ensure that sport is kept open, that we can find a way forward, and that the value of sport is represented to government. So I'll now pass it back to Shauna and Jared and Heather and the team to provide further updates on the provincial health order. Thank you.
Thanks very much, Charlene. So just a reminder before we jump into Jared's presentation, we've got Jerry, Denise, Kate have all asked their questions. So as you hear Jared speaking, please put your questions in the chat, and that really will help inform our question and answer period. So there's no question that's too small, too niche. Please put them all in there, and that'll really help our team prioritize which come first. And with that, over to you, Jared.
Great, thank you, Shauna. I'm potentially doing a last-minute audible of how I put together my presentation, and that's not what you should be doing. So if I'm looking this way, it's because I'm looking at the presentation. So I'll be doing kind of back and forth. I need to share my screen. There we go. And I would just like to say that I appreciate all the messages coming in about my hair. Yes, I have a COVID haircut. So thank you everyone for those comments. What we're going to be doing today, and as I need to, okay, we're good. Well, what we want to do today is provide clarity, and that's what Shauna said, and that's our hope. Now, in saying that, not everything is clear at this time, but we're going to share a little bit more about that process as well. And so the development of the public health order and what that has looked like over the last while as we've gone through so many changes in the last 6-7 weeks, and then what is Via Sport's role within that. Also going to go in detail about the restrictions, the current restrictions, and what we're facing, because there has been so many changes. We want to make sure that it's really clear of where we are in the current state, as well as give some insight of what's to happen as we move forward into the new year. So I want to start by saying the intent of the order. As the restrictions came in, sport didn't have the restrictions placed on them because we've been behaving poorly, and that I want to be really clear and upfront on. There's been restrictions in every part of our lives, in every sector. Gathering and events that have stopped altogether, except for small weddings, funerals, and children and youth physical activity. Really, those are the only things that we are allowed under the gathering and events order at this time. So, we have lots of questions coming in about have there been outbreaks in curling? Can we see that evidence? Or have we been acting poorly? No, for the most part, no, we haven't. But as a collective, as we've gone through the second wave, we've had to put restrictions across every part of our lives. The intent of the order really is to reduce that risk. That is the intent, and everything that I would like to point back to is how can we reduce gathering with people and thinking about that in a sport context. The other thing that when restrictions come in, they are broad, and it's usually typically one line or one paragraph that is for a full sector. They are typically also a quick decision because of trends that they're seeing in real time. With this, there's always going to be unforeseen consequences. I feel for the 19-year-old BCHL hockey player right now, or the varsity athlete that's 19 that is not able to train right now. That's an unintended consequence of this order. But it was never this order was never trying to disadvantage some groups over others. But when it is something this broad, those types of consequences are inevitable. Now, what I want to talk about next is really how that order has been developed, and then what we are trying to do to solve for some of those issues that we've seen in the system. Over the past, the first restriction came in regionally as we were in phase 3 and starting to be comfortably in phase 3. We had the first restrictions in early November for the Fraser Health and Vancouver Coastal region. And since then, we've seen different iterations of the order, both written and oral from the Public Health Office. And we have been working within that space differently over the past 7 weeks. So sometimes they're seeing things in real time, that they're making decisions very quickly and putting restrictions in because they can't consult fully with the sector, because by the time they go through that consultation, they would already see more spread and consequences of our numbers going up. So that has happened, where at times we know the restrictions are coming no later or earlier than you. And we then are working in real time to interpret and get those messages out into the system, into the sector. They're looking at it from a holistic lens of all parts of communities and what makes communities, and a lot of what they've come to decide on is around travel and gathering of individuals. And so restricting that has seen different iterations, with travel by a health authority at first versus to where we are now. And overall, it's trying to manage the risks that in the new year that we can go back to being able to do some of these activities that we love to do, which everyone on this call is that sport. Now, as that has happened from a public health perspective, VIA Sport has had different roles, and so we are the sector experts, but we are sector experts because of the information that you give us and the insight that you give us. And so when you give us your concerns with how things are being implemented or how it's being rolled out in your communities, that helps us have the conversations with health when they're asking for our opinions and our advice, and then or we are sharing that. As Charlene mentioned, we do have a seat at the advisory committee that is supporting the development of the order, and they're looking for us and our support on how this could actually look in the system. Now, sometimes that those conversations, we see them go very well, and other times public health then has to make a quick decision because they're seeing something in real time. So there's no one process of how we are working with public health. The other part of it I would say is, as some things come up like vaccine rollout, that those are things that take priority, that then they can't commit to the timelines that they potentially had already committed to with updating the orders. So this is all evolving really quickly and changing. One thing that we have really tried to be really clear and they've heard is that the policy whiplash of our sector. We need to be, every time that there's one word that has changed on the website or an order has been updated, it causes a huge strain on our system to be able to implement and change, and strain on everyone on this call. And so what they're doing right now is trying to take a step back and get this right, so that when we move forward, that it is quite clear, and we don't have to do as much of the whiplash that we've seen over the last couple of months, because it's been very tough on everyone. So now I'm going to get into the current restrictions and where we are. Adult sport, all indoor and outdoor team sport for people 19 plus is suspended at this time. Now, what are some of the complexities of that order? The definition of team sport. We hear you loud and clear that the word team has been very difficult to navigate, and how what that is interpreted into the system. So we are working to update that definition, and that will come in an updated form of an order in the coming days, that people will be able to point to and have a clear idea of where their sport lands and what that means. So again, though, the intent of the order for adult sport is for there to be no gathering. The difference between, you know, a group of people for swim, you know, if you're a master swim team, yes, you are an individual sport, but it is still about coming together as a group. That is to be avoided at this time. So there will not be a separation between individual and team. It is adult sport as a collective, and there will be numbers of what, you know, of what that will then, how many people you are allowed to meet in a space under what is allowed for adult sport. That is still being in debate right now, and so I can't give more information than that, but it will be clear in the coming days of what is and isn't allowed under adult sport. But going back to the intention is for people not to gather. So as an individual, yes, I can go to the swimming pool and train, but I can't go with my team to train. I would also like to say that the list of sports on the government's website is not exhaustive. So even if your sport isn't named on that list, it doesn't mean that you can then participate in that sport. It is just an example, a list, so it's not exhaustive. The other issue that we're facing, I'm cutting off my part of my screen, but I can just talk to it. We hear you loud and clear that the split of ages for 19 plus is arbitrary, and is not easy to implement, and doesn't make logical sense in the system. So we are working to update that language as well, so that it will be clear that some people would be able to participate with their peers on their teams and in the leagues that are currently not able to. So we are working to solve that, and we've heard you loud and clear that has been a concern and issue. The other one that I'd like to point out is intercollegiate sport. The intention of the order wasn't to make so that intercollegiate sport could not train at this time. So we are also working with public health to clear that language up, so intercollegiate sport can continue to train in some capacity. The next part of the current restrictions are around children and youth. So indoor and outdoor sport for people under 19 years of age can continue, but there are restrictions on that at this time. Participants must maintain physical distance of 3 meters while on the field of play. So yes, this is a change from prior restrictions of 2 meters or the cohort model that we're in. Training can happen if 3 meters is maintained while on the field of play. I say field of play because a good example is for skiing, everything in the lines or all part of the facility, it will be 2 meters. But while on the actual act of doing the sport, that's when you need to maintain 3 meters. Same thing with an arena, 2 meters in, leading up to going on the ice, in lines, in dressing rooms, 3 meters on the actual ice on the field of play. Games, tournaments, and competitions and team events are not allowed at this time. So there should not be any formal games being played at this time. If there are time trials that are within the club where you're able to maintain physical distance and it's for a training purpose, yes, that can be allowed, but no gameplay at this time. When I say team events, team photos, Christmas parties, anything outside of the actual act of playing the sport should also not occur at this time, because that is an event, and should not happen. You at this time should only be traveling to your home club. So we did have other restrictions and definitions before. We are working on this definition right now, but at this time, you should only be traveling to your home club. So if you're crossing from Fraser Health to Vancouver Coastal to participate in a sport, that can occur, but you're only going to your home club and then returning home. There are no spectators allowed, unless to provide care for child and youth. Now, this has been also a contentious issue of what that means, and we for little ones that need more support. But it is also not an open ticket to be able to have all parents in the facility or at the facility to support that sport. And your child. So there still needs to be find a way of minimizing the amount of people that are in the facility at a time. And I know this one's difficult, but it is still necessary. Some of the restrictions or some of the complexities that we're working on, we know that the wording right now from government is local community, and what does local community mean? So we're working to shift that language, and at this time, being able to go to your home club is okay, and that is it. Now, a difficult one is around interprovincial travel. Interprovincial travel for the purpose of sport should not occur, cannot occur at this time. There are some situations that are more difficult to go through. So I'm going to try to outline 2 examples. If you are a team that is based in BC and you typically play in an Alberta league, that team cannot travel to Alberta for the purpose of sport at this time at any level in our system. That should not occur. What the difficulty is if there are Alberta residents that are part of a BC club. Now, the intent of the order is to minimize travel, and we need to do that to get through our second wave. If they're part of that club and they have another home in BC, then yeah, perhaps they can participate. But if you are traveling into BC, getting a hotel room, and maybe that is part of your club where you're still coming in every weekend, it is a difficult decision to make, but we do need to minimize our travel at this time, and really need to be thought through. But there's nothing that we can point to within the order that says no, that there's no travel, or yes, that there is, that it is allowed. So a team, cannot go for the purpose of sport at this time. Where it is your home club, it is more of a decision that needs to be made locally, but really thinking of the intent of the order is really important at this time. The other current restriction that has been in the order is around high performance athletes. So they are able to train and travel within BC, provided they are following the safety protocol set by their respective provincial sport organization and the national sport organization. I want to clear some of the issues that we're seeing with this definition. Depending on what sport you are from and how you define high performance can vary. We recognize that the definition of high performance means a lot different things to different people. Right now, it is for you to have the exemption, you need to be on the Canadian Sport Institute Pacific eligibility list, their high performance eligibility list. I know that there are some sports that feel that it doesn't equitably represent their sport, but for us to have this in place, we needed to point to a certain list, and that is the only way government would have this in. This clause in is that we had a really clear list of it. So at this time, if you are on the Canadian Sport Institute Pacific eligibility list, you are exempt. If you are not, then you don't have you have to follow the order. There will be no exemptions for certain sports or leagues at this time, and so this doesn't mean that this will unfold differently going into the new year, but at this time, this is the list that we have to follow. We are working to clarify some of the language on the order, so it is quite clear of what that exemption entails. And so that's something that will be coming shortly. What's next for return to sport? I know this is the question that I get probably most often is what will it look like in the new year? And I want to start by saying no one knows what it'll look like in the new year. It depends on how we are doing as a province, not just in sports. It's more so about where our numbers are at and our community transmissions that will dictate what we'll be allowed to do come in the new year. We know that the current restrictions that we have are until January 8th. We know in the short term, in the near future, there will be those changes that hopefully there will be those changes around the mixed ages, varsity sport, high performance sport definition, and clearly articulating what community means, as well as the definition of adult group sport. Those 5 issues will be clarified in the short term, but once that is set, this will be until January 8th. The restrictions that we're in, those restrictions may very well be extended past January 8th, but that will be decided come the new year and dependent on where our numbers are at. We don't know how long these restrictions will be in place, and if it is put past January 8th. What we are working on in the short term now is that when we come out of the restrictions that we're in, we are going to be moving towards via sport our guidelines, return to sport guidelines 2.5. So we're working with the Safer Sport Fitness Recreation Advisory Committee that is our link to public health and other ministries and sectors of what a intermediate between where we were in phase 3 and the restrictions we're in now could look like as the restrictions become can ease a little bit. So we're working on that right now, and as we move into the new year, when the province is ready to ease restrictions, we will be moving into our phase 2.5. We don't know exactly what that looks like. We have conceptualized it and are now working with public health to develop a more comprehensive plan going into the new year. Okay, that's it for me, Shauna, in terms of the formal presentations. I'm going to hand it back over to you, and yeah, we can start taking some questions.
Yeah, that sounds great. And there's tons coming in, which is really exciting. So as I said before, please keep them coming. And Heather will be specifically looking as we're, if I'm posing a question to Jared and you want something to be clarified a little bit further, don't hesitate to ask it then as well. And Heather will support us getting as much clarity as possible. So I'm going to start kind of broad, Jared, and there's some questions around kind of the justification of why this order. So I know you spoke to a little bit, like, we haven't had any outbreaks in our sport. We were following the protocol so carefully. Why sport? Why not department stores? So can you talk a little bit more about, your understanding of why the Ministry of Health put these restrictions on sport?
Yeah, they put restrictions on most parts of our lives around gathering. I'm not seeing my parents for Christmas this year because that's a restriction that's been put on us. And similar to sport, they want to see less people unintentionally, even if you are following all your safety guidelines to a T. And I know 98% of everyone in the sports sector, we are doing that, and we've done a great job, and they know that, and they wanted us to make sure that we really clearly articulated that sport isn't being punished because of bad behavior. So even saying that there's been restrictions that need to go across all the board, and a part of that is sport. They still see the value in it, and one of the only things that we are allowed in the gathering events is sport for children and youth, because they see the benefit of it for mental health and the continued social interaction with children in BC. That's the answer.
Yeah, I think that's helpful. We did have a specific question, some around, so lots of questions around, what are the current guidelines for specific sports? And one around, are we still in phase 3? So maybe start with, are we still in phase 3? Should organizations be following those phase 3 guidelines?
No, we're not in phase 3. The current restrictions are the ones that I just outlined. So maintaining physical distance of 3 meters, travel to your home club, no spectators. Those are if I take the 3 points, those are the things that you should be following. Now, every PSO has been updating and articulating that out as well. So that should be also coming from your provincial sport organization.
Maybe I'll just add to that, Shauna. I think there has been some communications out there that have said that we're in phase 2. So we are most closely aligned to phase 2 right now, but it isn't exactly phase 2. As we know, there's a lot of differences right now across adult and youth, and different travel restrictions and things, exemptions that weren't in place while we were in phase 2. So we need to follow the order first before any of those phases within the guidance.
Right, so the order trumps the phases. Okay. I did get one specific question. Does each sport have to follow the order specifically, or can they make their own rules and guidelines within the guidelines? So sort of, yeah, go ahead.
You have to follow the order. The order is not a guideline. It is bound by law. It's a public health order. So just kind of building on what Heather just said, that is that we have to follow at a bare minimum. Now there could be more restrictions on more that put in that a provincial sport organization can put on because they know their sport better than anyone, but at a bare minimum, the order needs to be followed.
Okay. And then there were some questions around guidelines for more fitness recreation. So yoga, public skating, those kind of things. What's the indication for those sports?
Yeah, so there was just a release of the low intensity group fitness guidelines. Those just came out in the last couple days, and clearly in it. So one part of the restrictions that came out in the last month is when there was indoor group fitness and gymnastics and martial arts and cheer were named under it, and it was causing a lot of confusion of what's fitness and what is sport. It is now clearly articulated in those guidelines, the low intensity group fitness guidelines, that martial arts and gymnastics, that they aren't part of those guidance, and that they fall under the sport part of the order and our guidelines. So those sports, I know they've been shifting in and out of the fitness and sport. They're part of the sport order and our guidance.
Yeah, so there's a few questions about yoga and dance specifically. So what we would suggest is we'll make sure that the low intensity fitness guidelines are also posted on our website, so you can refer to those. But then additionally, we've had some questions about we're a sport, but we believe that we can follow the low intensity fitness guidelines. Can we continue to play our sport?
I would have to see examples. It would be really difficult for me to answer.
Yeah,
that.
I think it was a racket sport. So the question was around, as a racket sport, we in the game that we play, it is low intensity. So I think there it's really about the definition of sport, and whether or not you can follow that guidance isn't really the question. Is whether you're for sport or fitness. So therefore, what piece of the order should you be following?
Yeah. So for racket sports, and I think this has been, it seems like every part of the order or part of return to sport, there's a group of sports that are really trying to figure out where they landed in. And right now, racket sports is one of those. If you can't maintain 3 meters physical distance, you cannot be playing. So that needs to be really clear up front. 3 meters, you need to have 3 meters physical distance between you and your teammate, or else you should not be playing at this time. And the racket sports should be following the sport part of the order and our guidelines.
Yeah, and I'll just maybe quickly add again, like the low intensity aspect is one thing, but some of the other qualities of the fitness activities that have been called out are that there are more stationary or able to stay within a defined area, whereas we know in sport we're moving a lot more, especially like if we're responding to a ball or trying to retrieve something, or it's a lot harder to stay within a defined area, and keeping that 3 meters or whatever that distance is becomes more difficult. So there are other differences that have been considered in those guidelines as well.
Okay, that's great, helpful. Thanks for jumping in, Heather. So we've got quite a few questions about training. So training for both adults and youth. So let's start with adults. For those, so you mentioned, for example, like I can go to the swimming pool by myself as an individual person. How many adults right now can come together if it's kind of informal? Can they have a coach or an instructor there? What's kind of the limit on that kind of gathering?
Yeah, this is where we're going back and forth with public health right now, and there will be a clear number in the coming days. For me to give that number right now, it hasn't been signed off on and landed. I don't want to say one thing and then all of a sudden it changes in the next couple of days. I do want to say that think small, minimize and really minimize the amount of people at this time. And there will be a clear number soon for adults.
Right.
Yeah,
adults,
but where we do have clarity on is you as an individual could still access a facility to practice or train, and potentially also have your coach if you have a coach with you. So definitely that 1-2 is probably okay.
Yes.
And then just to be specific about that, because we did have a few questions from gymnastics, et cetera, that does that coach and that individual need to maintain the 3 meters or the physical distance?
Yes. Yeah, they should be at this time.
Okay. Okay, let's move on to this, the difference between adult and youth, because I think, as you mentioned in your presentation, Jared, this is a challenging one. So what should youth sport look like right now? So we've had some questions about, like, is 3-on-3 scrimmaging okay? What about contact sport? So can you just kind of give us a picture of what exactly youth sport should look like right now?
Yeah, drills and skills, maintain 3 meters at all times, like that's straight across all sport right now. So scrimmaging for contact-based sports, no, that should not be happening at this time. And it should still be about, minimizing the amount of people that are on a field of play to ensure that they can maintain that distance. And that's for children and youth.
Okay.
So Jared, if you're able to maintain distance, could you have a time trial or a game that in which you are maintaining distance?
As a training activity, yes, but is bringing together more people than are necessary, no. So a good example Yes, you could have a time trial for swimming, but if it's bringing together more volunteers and officials, and then no, that shouldn't happen at this time. So if it's for a training activity that resembles an actual competition, with those precautions in place, yes, that can go ahead.
Okay, sort of a broad question here, but how was adult determined? And I think the follow-up was, real frustration around. So in this example, I have a 19-year-old who's been billeting with an 18-year-old. They just had a birthday. Why is it that this 19-year-old is unable to play? So first question would be like, how was adult determined and why? And then I've got a follow-up.
Yeah, and this is where I talked about at the beginning of the unintended consequences. Whenever a very broad order is put in, there are always unintentional concerns that come to the forefront. The 5 that I've mentioned on this call are the ones that we're trying to solve for. Is the intent of the order to make it so that 19-year-old can't participate with their 18-year-old on the same team? No, that's not the intention. Is that how it's written right now and we have to follow it? Yes. Are we trying to solve for it? Yes, and that will be solved for in short order. That's in terms of why adults. We're all making sacrifices right now in every parts of our lives, and right now it was determined, not we, public health determined that children and youth, let's try to keep them active. Adults, we got to take a break, and we'll come back to it in the new year when we get the second wave under control.
Yeah, okay. And so just to dial down a little bit further, so Craig, for example, had a suggestion, why don't we just call them minor athletes? Do you think that change is coming before the January 8th date?
Yeah, I do think it's coming before January 8th.
Okay, that's exciting. Okay, let's move on to this sort of some questions around community and the definition of home club. So quite a few questions coming in pre-submitted, but also this afternoon. So if I'm registered with one club, but I don't live in that community, so say for example, I live in Vancouver and my club is in Whistler, or I'm in a small town outside of that community where my club is, can I travel right now to attend practice if I'm a youth?
Yes, you can go to your home club, but the further that you are going away, the more that you should be thinking about how necessary it is, or if there's other options. We all understand that typically, like snow sports, you travel further because you have to get to snow. So yes, you can go to your home club, but if you typically carpool with other people on your team, that should not happen at this time. If questions of can we still use our team bus to bring up all the athletes, probably not at this time. We need to minimize the amount of exposure to others. So that needs to be really clear. If you are traveling a little bit further to get to your home club, how are you still trying to minimize the exposure is really important. And yes, you can travel to, if you live in Vancouver, you can travel to Burnaby if that's where your home club is.
Okay, and then we did get a lot of questions about this Alberta issue, mostly from ski and snowboard clubs. So if I run a ski club in Alberta, am I prohibited from allowing, run a ski club in BC, am I prohibited from allowing Alberta residents to register, to travel to me, to participate? What's kind of the line there?
This is one of the hardest ones to answer, and yeah, I feel for those people in that spot trying to make some of these decisions, because travel for interprovincial travel for a team, so a team from Alberta cannot come to BC right now. The team from BC cannot go to Alberta right now for a purpose of competition or whatever it may be. If you live in Alberta and your home club is a ski resort in BC, we can't prohibit them from coming to BC. So I want to be clear of that. We can't prohibit them. As a club, you have to do a bit of a risk assessment and seeing what kind of policy you would also want to put in place. Can you prohibit people right now from Alberta coming? Well, through your governance structure, yeah, you could build that in. Are we suggesting that? It's really situational, but our plea and our communication out is, if you don't need to travel this time, don't travel. And so it leaves you in a little bit of a spot. I know I'm not being as clear as you want me to be, and I'm sorry about that, but that's all the advice that we can give at this time.
Okay, appreciate that. Let's move to high performance. So one question is around the designation of high performance. So if an athlete is a participant in a program that's designated high performance but is not on that Canadian Sport Institute list, they currently cannot be participating.
Correct.
Yes, okay. And do we see the performance expanding anytime soon?
The anytime soon one is really is so difficult to answer. Do we think it's going to be expanded? Yes, but with what time and what part of our back to phase 3? I don't know.
Yeah. Okay, that's
yeah, and there's some additional curiosity, I think, about what are the eligibility per sport, and so that information is available on the Canadian Sport Institute Pacific website as well. It is the provincial sport organization that nominates athletes to that list annually, so the PSO would have that information as well.
Thanks, Heather. I have one question around spectators, actually two that are the same, and that's around for like quite young children. So is there any consideration around, we run a program for 4 and 5-year-olds or a U12 program for having one parent be there, help put on skates, what have you? Any considerations for that?
Yeah, this is and I talked about this in the presentation. Well, this one's difficult. We still need to minimize the amount of people that are gathering. So how can we, it can be 3 or 4 volunteers, that parents that are doing that for more than just one child, like that, things like that for the younger ones. But there isn't a clear, this is allowed, this isn't allowed. But again, when you're making these decisions, how do we minimize the amount of people that are in the same space?
Yeah, okay, thanks for that. Okay, some few questions around specific protocols. Let's start with the 3-meter distance. Why is it 3 meters for youth and now instead of 2?
Public health has told us that they wanted 3. We have a higher heart rates when we're participating in sport, which increases the distance that they deem as safe. And at this time, when there's this many numbers in our province, they want it to be 3 meters.
Okay, does the 3 meters still apply if everyone's wearing a mask?
Yes.
Does it apply when you're riding a gondola or sitting on a bench?
No, it's only on the field of play. So it's when you're actually doing the act of the sport, when 3 meters is in play, it's 2 meters anytime else.
So just to make sure, go ahead.
I was going to say, to add to that, when you're not on the field of play, you should be wearing a mask.
Right. And just maybe as a follow-up to that, quite a few questions around, between staff and coaches or between staff and athletes when they're not on the field of play, just to confirm that's 2 meters in the lobby.
Yeah.
Okay.
Can I add to this one, Shauna? I think there's been a number of questions. I think you did address it, Jared, but maybe we could help to clarify. There's still some questions around, like, in our sport, we can maintain 3 meters distance at all times. So can adult sport continue?
No.
I think, and that's to speak to, there are additional concerns, and it's not just the 3 meters of distance. So it's not as simple as just maintaining 3 meters distance, but it is something that we're looking at, and in the next phase of opening back up, that hopefully some of those activities may be able to continue.
And yeah, and I they're not, we think that there are a lot of situations in sports where adults are participating that it's really safe. And we see that, but this is where it is a broad order and is restricting everyone. And so some may not make as much logical sense as others. And I see that in the conversations that I'm having with people. I'm like, yeah, you're right. Like, that's a pretty safe thing to do. but at this time, we're all having to make sacrifices, and this is one of them. Is even if your sport is safe and you're following everything to a T, there's more likelihood of gathering as a collective, as a province, and so that's what we're trying to minimize. So it's not as much about that. Sometimes it's not as much about the actual act of doing the sport.
Right.
Yeah, and as well, that we're really pushing health to say what are the conditions that are safe, and if any sport can meet those conditions, then they should be allowed, hopefully, to continue. It's not about this sport or that sport; it's about the conditions of safety.
Right. Yeah, that makes sense. Okay, I see the time ticking down, and I knew that we would be running out of time for questions. So I'd like to do a bit of rapid fire, although sometimes the answers can't be rapid fire. But we had quite a few questions coming in around, if I have an athlete with symptoms, but they have a negative COVID test, can they play? They have a sniffly nose. Can they attend if they're youth?
Yeah, this is not rapid fire.
Sorry.
So if they have symptoms, if they currently have symptoms, they should not be there. If they had symptoms, then don't have symptoms. Once they don't have symptoms, and if they got tested and it's negative, they don't have to wait 14 days. They can play.
Okay, and then if there's a participant who lives at a house with someone who's tested positive for COVID, can they be there? Can the organization require a test before they come back?
Organization cannot require a test. That's something that this is a public health. So public health will provide clear direction to that household of what they can and can't do, and then that is what should be followed. In the meantime, if someone in your household has COVID and public health hasn't reached out yet, be cautious, and you self-monitor, stay at home, wait till public health reaches out, and then go from there. But as an organization, no, you cannot say that you need to test and you need to be negative for 14 days, whatever. That's not the organization. That's a public health decision.
Right. Okay. I want to ask some sport-specific ones, and then we're going to finish with some questions around timing. So still questions coming in around racket sports, tennis, badminton, squash, pickleball. Can adults play doubles?
If you cannot maintain 3 meters while playing doubles, no, you cannot play. If you can maintain 3 meters, then yes, you can. And yeah, so that one is really clear. Same thing with playing against someone. If you cannot maintain 3 meters in a racket sport playing against someone, then you should not be playing at this time.
Okay, and then for youth, so I saw a question come in from my old boss, Wayne, actually, so I have to ask it. Children playing tennis, so competing at the game of tennis, they've got 4 children playing on 2 courts, they've got coaches supervising on both, and all maintaining distance. That's okay?
Yes.
Yes, okay, great.
Thank you for the easy one, Wayne.
Yeah, I have a couple questions around curling, but then also a really great one around seniors, knowing that the importance of social connection for seniors and the risk of social isolation right now. Is there any consideration that seniors sport, in specific here, curling, will be exempt anytime soon?
I would love to go into a lot of detail about this one, but because I sympathize with the situation, and I feel for those people that are socially isolated right now and would need these sports. But no, there will be no exemptions for sport specific type of activity in the order, and we're all having to make those tough decisions in the short term so that we can get back to play and go and have these social situations again soon.
And that's like some of the stuff that we're looking to address in the 2.5. So hopefully 2.5 happens sooner rather than later, but that will be under the direction of health.
And then just another follow-up on curling. So if right now I have 4 adults, they're going to play 2 per team. We've got a huge space. Curling rinks are massive. Can we go and have a bonspiel right now?
No bonspiel. I want to actually bring this one up a little bit higher level, because a pickleball example, or some like the difference between me going with my one friend to play a sport is different than me going to play. So if it's tennis, me going to play to the one court with my friend and playing tennis, that's okay. If it's us coming together, there's 10 of us, we play one game, then I switch, I play someone else, and then no, that's what we're trying to avoid. Same thing with curling. I can't give that number right now of what isn't okay. Start small. There's going to be guidance on adult of what is and isn't okay very soon, in terms of the actual number of coming together. But even if it is 4 people, it would be 2 on 2. Those 4 people or 2 people shouldn't then be going playing 2 other people. It would be just that group, a small group coming together, and that's it. Again, I can't confirm those numbers, but we'll have that out really hopefully soon.
And in the interim, the answer is no, because curling is one of those sports that are called out in the definition of team sport. So until we have a specific number of allowance, then the answer is no. And if the number is 4, maybe mixed doubles could occur, but right now the answer is no.
Okay, and I just want to dial in on this because I'm still getting quite a lot of questions around the 3 meters and adult sport. So if the 3 meters is maintained, can we play lawn bowling? Can we play racket sports? Can we play, can you just be really clear about the differentiation between the 3 meters and sport moving ahead?
They're together. Me with my one friend can go play tennis if we can maintain 3 meters. I can't go play doubles. I can't go play doubles badminton right now because I can't maintain physical distance. And we don't, and right now that would be a group coming together. I can't play squash right now with if I can't maintain 3 meters physical distance. So that's really clear that you have to maintain 3 meters, and you still have to make it so that you're only doing it with one other person. We are working on clarifying the definition of adult sport, and that's what we've been continuing to talk about, is what that number is and what that definition is. That will set clarity for the restrictions we're in right now. But in the meantime, it's confusing. I get it, and it's restrictive.
I appreciate that. Looking at the time, I want to ask one more question, and then Jared, I'll just give you a minute to close. What happens after January 9th if the restrictions are lifted, and what happens if they're not?
What happens if they're lifted is that we'll have guidance via or return to sport guidelines 2.5. I can't tell you exactly what's in it right now. We're still working on that with public health. We'll be working and giving as much laneway as possible for the provincial sport organizations to understand what those guidelines would be, so that they can update their sport specific guidelines as well. So that's something that will be happening in over Christmas, so that we're ready to go if those are if the easing of restrictions happens on January 9th. Now, if it doesn't happen, we're going to be in the state that we're in right now, and we'll continue to be in until this order is rescinded. So and at that, whatever moment that is when we'll be moving into 2.5. Always, the last thing I'd say about that, there's always potential that changes. The pandemic is impossible to try to guess what's going to happen next. This is what we've planned for, and we think it's quite a clear plan, something that I think will happen, but it's really difficult to tell depending on how things go over Christmas.
I appreciate that, Jared, and we're getting some comments in now, thanking us, knowing how complex it is. Go ahead, Heather.
Sorry, I know you are really concerned about wrapping up on time, but I do think there is one other question that we should address, and we haven't talked about it at all on this call, but there was some questions around the ability to run a coaching course.
Good question. If it is absolutely necessary, and you do everything that you can to have virtual gatherings or meetings as part of it, but if there is some content that needs to happen on the field of play as a practical part of the coaching course, they can occur, but really think about it if they are necessary. at this time. And so there's been some sports that we've worked with, and it has been necessary for them to actually make sure that it's safe and that their programs can run for 70% of their membership. Those cases, yes. But if it's just oh, I had it in the calendar, maybe that's when those should be postponed at this time.
Thanks very much, Jared. And with that, I do want to close on time. We'll capture the questions. You'll be linked to a survey now. If you have additional feedback or questions, we'd love to hear from you. I wish you all a happy holidays, and please know that we're just as passionate about returning sport to communities in a healthy way as you are. And so thank you so much for your time, and enjoy a little bit of a break over this holiday season. Thanks for joining us.
Bye, everyone.